For all the latest updates, subscribe to News9.
Hello and welcome to News9 Digital. I'm Ashish Parekh. The topic that we'll be talking about today is the migrant crisis in India and how it has triggered the rural clusters of COVID-19 across the country. We all know India is recording a lot of cases these days. In fact, the number of cases are easily crossing the 9,000 mark, and in fact, it even touched 10,000 almost on Thursday. But this is something that the authorities have a note on. But apart from all of this, there is a bigger problem that looms large for the country, and that is the fact that most of the cases being reported these days are from rural areas. Initially, we had a lot of cases coming in and all of them were from cities. People were traveling from abroad, coming into the cities, they were quarantined and they were tested positive. But these days, the cases are coming in from rural areas, and this is a ticking time bomb as far as authorities are concerned, because the fact that these cases, the COVID-19, the coronavirus has seeped into the rural places, it makes it even more difficult for the authorities to contain the entire situation. And most of these issues started coming in when the migrant laborers started traveling to their hometowns. Everyone who was in the cities, everyone who was working in urban pockets which were contaminated by coronavirus started going to their remote hometowns in UP, Bihar, Rajasthan, Chhattisgarh, many other states. I have a bunch of data from different states across the country which would probably give us an idea as to how much an effect the rural places have had as far as the coronavirus is concerned. Let's first talk about the two main states that have the most number of migrant laborers across the country, Uttar Pradesh and Bihar. Talking about Uttar Pradesh, so far 30 lakh migrant workers have returned to Uttar Pradesh from various parts of the country, and the shocking part is that most of the cases that are being reported from rural areas are of the migrant workers, and this is an alarming sign. This is an alarming sign for authorities. Also, speaking about Bihar, you almost have 20 lakh migrant workers that have returned to the state from all across the country, and again 70% of the total cases that have been reported ever since May 1 in that particular state are from people who travel from the rest of the country to that particular place, that is migrant workers again. You also have a similar situation in Rajasthan, where the number of cases in the rural areas are surpassing the number of cases in the urban areas. In fact, as per the data that we have, about 30% of COVID-19 cases in that particular state in Rajasthan are from rural districts, and the worst affected districts due to this migrant crisis are Dungarpur, Jalore, Jodhpur, Nagaur and Pali. So these are places where a lot of cases are being reported over the past few days. Moving on to Andhra Pradesh. Now, until about a month ago, almost 90% of the cases in Andhra Pradesh were being reported from urban places. But everything has changed over the last 3 weeks, ever since there is the migrant movement that we've been talking about. Out of 1,500 cases that were reported over the past 3 weeks, 500 are from rural areas, and that again highlights as to how this entire situation, this pandemic, is shifting to the rural pockets of the country. Apart from that, Odisha as well, 4.5 lakh migrant workers have returned to Odisha so far, and 80% of the positive cases in Odisha are from rural pockets. Again, rural area being targeted, rural area being affected. And Kolkata as well, nearly 6 lakh migrant workers have returned to Kolkata, and most of the cases that are coming in right now are from Malda, North and South Dinajpur, Hooghly and Kuch Bihar. Chhattisgarh, where a little over 2 lakh migrant workers have returned back to the state, and the number of positive cases in rural areas has climbed to 464 from the beginning of June, and this number was just 8 as of May 1st. So you can clearly see an exponential rise in the number of cases in rural districts in Chhattisgarh as well. Punjab is an exception, wherein you don't really have migrant workers that actually travel back to the state. You have a lot of people testing positive in the rural areas because of a pilgrimage that was undertaken in Nanded of Maharashtra. Yes, this particular pilgrimage was undertaken, and the government is somehow responsible for the carelessness and the situation that exists in the state right now. Now, Nanded in Maharashtra is a home to several historical gurudwaras, including the Hazur Sahib Gurudwara. So what exactly happened is that the Punjab government arranged buses for pilgrims who were stranded there, and that is when a lot of people from Nanded traveled back to Punjab. And the shocking part of all of this is that none of them were screened before they entered Gujarat. As soon as cases started coming in from that particular bunch of people who had traveled back from Nanded to Punjab, that is when they started screening everyone, and that is when a cluster of cases started coming in, and that is when they realized that all of these cases were coming in from Nanded, and by that time the rural areas of Punjab where these people had come back from Nanded and had settled, those places were absolutely contaminated from COVID-19, and now you see a sudden spike in the number of cases in the state, especially in rural areas. So all of these states, all of these all of this data that we've been looking at clearly points to the fact that the entire pandemic has shifted its focus from the urban pockets to the rural pockets. Yes, urban pockets are still infected, but the fact that most of the action is now taking place in rural areas is a sign of worry. Why is it such, why is it so difficult? What is the difference between someone being affected from COVID-19, a cluster being there in an urban pocket, and then a cluster being there in a rural pocket? There's a lot of difference between the two. First, when there is a cluster in urban pocket and there are cases being reported, you have a lot of facilities available. There's robust infrastructure. A lot of other things are in much better position than comparing it to the rural areas. In rural areas, first issue that you face is that finding out the fact that someone is infected from COVID-19 itself is a task, because there are a lot of tribal pockets as well which are reporting COVID-19 cases across India. A person who might be having the case would not really come out and report it. There might be neighbors who might notice it, and by the time it all reaches to the authorities, that person might have come in contact with a lot of people. So that is one issue that they could face. And apart from that, also the fact that the medical infrastructure, this is something that we all have to be honest about. The medical infrastructure in the country itself is not that great, but especially when it comes to rural areas, we all know what the situation is. What does the government do? They try to shift these people back to their hometowns so that at least they can live a comfortable life. But what happens in the process is that they also inadvertently, without knowing, shift the coronavirus to the rural pockets which were free from coronavirus. And this is a tragic situation that has come to light. What do you think? What do you think the government should be doing? What do you think the government could have done better initially? And what is the road ahead for the country because of the fact that the entire action has shifted to the rural areas? Make sure you comment your views in the comment section, and also do not forget to like, share and subscribe to News 9. Thanks for watching.